This is Duke University.
Well, good afternoon. We'd like to begin. I'd like to welcome you to the Fuqua School of Business. My name is Matt Nash, and I'm with the Center for the Advancement of Social Entrepreneurship, where I serve as the Special Project Director for Social Entrepreneurship at Duke. And I also have the honor of being the Center Director for our new Social Entrepreneurship Accelerator at Duke, which is a USAID development lab for scaling innovations in global health. Essentially, we aim to identify proven innovations in global healthcare delivery and prevention, to support those innovations and to help them achieve a greater scale of impact, to have direct effect on lives around the world. And we're particularly thrilled to launch SEED this week with this event. This is the first annual Duke Symposium on scaling innovations in global health. So we are thrilled to have you as part of this group, and we're especially thrilled to welcome 13 amazing social entrepreneurs from around the world involved in a wide variety of innovations. And if those of you in the room who are in the first SEED cohort could just raise your hands, and if we could all greet you with a round of applause. You'll all have a wonderful chance to meet them in our breakouts in just a few moments. So we're thrilled to kick this off. What I'd like to do is call up our Director of the Global Health Institute and Vice President and Vice Provost for Global Programs and Strategy, Mike Merson, to welcome us and kick us off. So, Mike?
Thank you. Thank you, Matt. So we're a little bit late, and so I don't want to hold us up. I want to get into the program as quickly as possible. I want to officially welcome you on behalf of the university. Now, some of you have heard, been sitting for 2 days and heard a lot about Duke, but some of you are just coming to this session. And I think what I want to say more than anything else is that we are honored to be able to be partnering with USAID and other universities in a new and exciting higher education solutions network, which USAID has established to bring about greater involvement of universities in the global development network. And in a fairly competitive process, we were selected, as you heard from Matt, through our SEED project to be a hub in global health and innovation. And in this regard, I want to just a minute to say a few, point out, I'd like them at least to briefly stand after I say their names. We have from the Office of Global Health, Ariel Pablo Mendez, the director, Wendy Taylor, Karen Kloon. Could you just stand so people know who you are, or raise your hand, whatever. And we have from the Office of Science and Technology, their director, Alex Deegan, and then Takora Jones, Lala Faz, and Michelle Shimp. I don't know if they're all still here, but if they are, could you raise your hand or stand so they know who you are? Then, of course, I also want to welcome our social entrepreneurs. As Matt said, we know that your goal is making a difference in the lives of thousands of persons around the world, and we're there with you. Now, SEED, as we call it, S-E-A-D, is led by a partnership of CASE, the Center for Advancement of Social Entrepreneurship at the Fuqua School of Business, and the International Partnership for Innovative Healthcare Delivery, which we call IPIHD. It's hard to say, IPID, in the School of Medicine. We are also a partner in the Global Health Institute, as are many other groups across our campus. Too many to say here, but I'll also want to mention another important partner is the Investor Circle, which is the world's oldest, largest, and most successful network of early-stage impact investors. I don't have to tell this audience that health is widely recognized as the linchpin of economic and social development. And for decades, aid agencies and governments and foundations in the private sector have invested in health innovations, but we have often seen them struggle to achieve a scalable impact. And we want to change that through the SEED project. Around the world today, countries are striving to improve access, affordability, and quality of health, but countries are also facing the rising tide of non-communicable diseases, changing demographies, and lack of adequate infrastructure and human capital is putting greater pressure on health systems. So all of this can be seen as a difficult situation. It can also be seen as a challenge and creating opportunity for new and innovative models of health. And that's very much what AID is trying to achieve, and that's very much what the SEED project is about. Now, I think you all know what SEED stands for, but in case you don't, the S is for spark, select, and scale new solutions and technologies to address global health challenges. The E is to engage in building an ecosystem of networking support and access to investment capital to help entrepreneurs scale their enterprises. The A is for assess the effectiveness of SEED, the development problems it engages, and the solutions it supports. And the D is to disseminate practical and academic knowledge and evidence about scaling health innovations globally, especially among actors on the ground in developing economies. The wonderful thing about SEED, I think, is that it brings together here our faculty, students, and then outside of here, our partners, to mobilize practitioners, investors, and policymakers in low and middle income countries to develop and identify promising global health innovations, scale them, and assess their impact. Here at Duke, we see SEED as a virtual hub for faculty and students interested in global health, interested in international development, interested in innovation and entrepreneurship, and interested in civic engagement. It's a beautiful fit for our university. SEED aims to enrich student experience, support global health innovations, advance a culture of academic inquiry, inspire a commitment to change-making in global health among a new generation of students, and engage our faculty in evaluation and policy research and dissemination. Those of you who know Duke and know our Global Health Institute, we are channeling the passion of our students and faculty to make a difference. That is the title of the university's strategic plan. It's very much a distinguishing feature of our university. We are committed to improving the health of populations around the world, and SEED builds on our university's commitment to global health, interdisciplinary collaboration, civic engagement, and the translation of evidence into action. And I mean it when I say it, but global partnerships are part of Duke's DNA. So through this initiative, we aim to have a profound and lasting impact on the myriad of stakeholders committed to improving global health. And all of you are in the room: innovators and entrepreneurs, the funding community, USAID and international development, students and faculty, and policy and decision makers. So I hope over the course of this conference this afternoon, you'll be able to learn more about the potential of social entrepreneurship in global health, through innovators blazing a trail towards impact in the field, through our faculty and staff working at the intersection of these two fields, and through our colleagues at USAID who are striving to identify and implement new approaches for meeting the most pressing challenges in international development. I hope I've made it clear that everyone at Duke, building upon our university's commitment to global health and innovation, is excited to partner with USAID to catalyze and build an evidence base for innovative solutions to the global health challenges of today and tomorrow. So with those words, I welcome all of you, and let's get on with the conference. Thank you.
Produced by Duke University. Online at duke.edu.